All right. Good morning, everybody. We're going to get started again. I'm very happy to actually introduce our first panel for this morning. I'm Winston Wong. I'm Medical Director, Community Benefit at Kaiser Permanente, and I've been very honored to be part of the IOM Roundtable on Health Equity for several years now. So we are going to start this morning after the great introductions, and I wanted to certainly concur with our opening remarks, how thankful we are to have this convening in Detroit and to learn about this great city, as well as certainly having Wayne State University be our host today at this great site. I hope, I just get the sense that there's a lot of buzz in this audience. I was wondering how many of you have already tweeted about the morning, because use your technology and get the word out. And actually, we do follow the tweets from the Institute of Medicine. It's a very active part of how we're trying to cultivate social media and make sure that the proceedings and the conversation and the discussion is going out in real time, as well as subsequently in the proceedings that will be published. So I do want to introduce this first panel, which is how do we engage providers and minority patients in digital strategies with the goal to reduce health disparities and promote health equity. I must say the precision of the words we used to describe this panel was very purposeful. We will have other panels that speak specifically about community engagement. This is about providers and minority patients. I will be just introducing the panelists, and my distinguished colleague, Dr. Varma, will be facilitating the comment period and question and answer period after we have our three presentations. It does remind me, too, that in all this discussion, you know, the biggest IPO that came out in the last several years was Alibaba, right? That just came out last week, which really reminds us the genie is out of the bottle here with regards to technology and the harnessing of information. The genie, of course, is agnostic whether he does good or bad, and that's probably the same metaphor that we can use in terms of thinking about health technology, and whether it actually widens the chasm as we understand it in terms of health disparities, or whether it is the great leap forward to narrow and really make great advances in achieving health equity. So to kick us off on the interactive element of this day, we have first Dr. Ivor Horn. Now, you may know that in your programs there are very detailed biographies of each one of our distinguished speakers. I do want to just mention very briefly Dr. Horn's background as soon as I pull it up here. I had a chance to meet with Dr. Horn this morning. She is a professor of pediatrics at the University of Washington. She is leading their Center for Diversity and Health Equity in Seattle. I'm very excited about that in her new appointment, which she's only held for about 2 months after being at George Washington University for several years. She is also part of the board of the communication director for the Academic Pediatric Association, leading their work around looking at the issues of health disparities and health communication. After Dr. Horn, we have Dr. Misha Pavel. Dr. Pavel is professor of practice, jointly appointed between the College of Computer and Information Sciences at the Bouvel College of Health Sciences at Northeastern University. Dr. Pavel came to Boston from a position of a program director of Smart and Connected Health on a leave from the Oregon Health and Sciences University. And if you look at Dr. Pavel's distinguished background, it's very notable that he's had some key appointments in technology, including at AT&T Laboratories and Bell Laboratories, going back several decades ago. And is also very, well, Dr. Pavel has done a lot of work. Yeah. I think you invented the phone. No, okay. But certainly very distinguished, and it's very gratifying to have a non-MD also speak on this too. And finally, Dr. Ruth Parker, a very close friend and colleague of mine. Dr. Parker is at Emory University and really has been one of the leaders and champions of looking at health literacy, and has recently left the IOM Roundtable on Health Literacy, but continues to have a vital role in shaping the nation's agenda and policy discussion around health literacy, and she's done a lot of work around health communication. So with no further ado, I will invite Dr. Horn to provide us with our first presentation. We have a projection failure in our technology forum. Okay.